Okay, so listen, it really seems like everyone is sick right now. Aaron Rand is sick. Andrew Carter is sick. My mom is sick, quite sick. My mother-in-law, my neighbors, the babysitter, friends. I'm not kidding. Like everyone is sick. Some have COVID, some have the flu, and then RSV is still going around too. So it's being called a triple whammy. It definitely seemed like a good time to check in with Dr. Labos, find out how bad the situation really is, and what can we do to try to not get sick. As you know, Dr. Christopher Labos is a cardiologist with a degree in epidemiology. You can catch him 8:10 on Sunday mornings right here on CJAD 800 on Weekends with Ken. Thanks for your time, Dr. Labos.
Oh, my pleasure.
Listen, I'm not exaggerating. In my circles, everyone is sick. What are you seeing?
Yeah, I mean, basically the same thing. I mean, people are getting sick because we are unfortunately in the respiratory virus season. In case you need a reminder and, didn't see the snow this morning, it is winter. And now is when people get sick. And we have not just the usual culprits, which would be the flu this time of year. We're also seeing a lot of RSV. And of course, COVID, which, doesn't look like it's ever going to disappear at this point. So you have a lot of different viruses that are going to cause respiratory infections and make you sick. And just because you catch one doesn't mean that you can't, a few weeks later, catch another one. So you have to be careful. And especially if you're at higher risk, you've got to be extra duper careful because, if you're young and healthy, maybe you'll be able to ride these out at home. In fact, you probably will. The long-term consequences is a conversation for another day. Mm-hmm. But if you're at risk, and you get seriously sick, I mean, you're going to find going to the hospital to be a rather unpleasant situation right now. So trying to avoid getting sick is probably should be high priority, especially for people who have underlying medical problems.
Okay, so I mean, I didn't go to a gathering this weekend because I thought I might be. I had a tummy, like an unsettled tummy, and I was like, you know what? I don't want to make anyone sick. So that's a first thing, I guess. Like if you suspect anything, stay home. I'm still doing the hand washing and sanitizing thing. What else should we be doing, Dr. Labos?
Right. So the hand washing and sanitizing thing, it does matter a bit, especially if you're coughing and sneezing into your hands. You could then touch something. The idea of foam might spread, the idea of contaminated surfaces, it probably does play a role. But especially with COVID, it was not the primary mechanism of spread. And I think we have a better appreciation now that a lot of these viruses really are airborne. And so if you're going to be indoors breathing the same air as other people for any extended period of time, there is a chance that you can get sick. So if you're going to be somewhere where you're going to be breathing the same air as a lot of people, frankly, I would wear a mask. And you have to think about the really high-risk situations, the metro, the bus. If you're going to be, in a waiting room, waiting for a long period of time, you're going to be breathing the same air as people. I would wear a mask. And if you can get a well-fitted and N95 mask, that is really going to make the difference because while the hand washing is important, it's especially important for a lot of the cold viruses that are out there, especially when it comes to COVID and influenza. I think we have to acknowledge that a lot of it is airborne transmission for which hand washing isn't really going to offer that much protection.
I can guarantee you there are people freaking out, yelling at the radio right now. Oh my God, he said masks. I'm not wearing a mask. There's no way you can get me to. Are we, I mean, I appreciate you being prudent on that and putting that message out there. But if people aren't going to do that, should we just be kind of avoiding, are we at a point where we start to think about avoiding gatherings?
Well, I mean, again, it depends how badly you want to get sick. Right. And a lot of people, there are a lot of people out there who are saying to themselves, I would rather get sick than wear a mask. And you're like, okay, well, good luck to you.
And same for vaccines, right? Some people are like, well, I'd rather just get the flu than get the vaccine.
Well, listen, good luck to you. I don't think people appreciate how severe some of these diseases are. And, thousands of people die of the flu every year. And again, maybe you'll be a mild case, maybe you won't. If you want to sort of play Russian roulette with this, I mean, listen, that's the benefit of living in a free and democratic society. The point is, you've got to realize that the safety net that a lot of people assume is there is like, well, if I get very sick, I'll just go to the hospital. I mean, yeah, the hospitals will be there. I don't think people fully appreciate how difficult it is in the healthcare system right now. And this is turning into a chronic problem where there's no beds, where you have to wait hours and hours in the emergency room. And it's not as easy to access care as a lot of people seem to think it is or it once was. And so listen, at the end of the day, everybody wanted personal freedom to make their own decisions. Okay, well, now you have the personal freedom to make your own decisions. if you want my advice, I would try to minimize the possibility that you're going to get sick. And the way you minimize that is you make sure you get your vaccination to minimize the chance of severe disease. You avoid situations where people could infect you if you know somebody's going to be sick. And if you can wear a mask, that's going to decrease the risk even further. And if you can get an air filter for a situation, like if you're at work, that's going to help too, because if you can clean the air, that makes a difference. It's just that now you have to do all those things. You can no longer rely on somebody else to do them for you because we're not seeing huge waves of these viruses anymore. This is not something the government is going to institute. They basically put it on the individual. So that's sort of the situation where we're at now. I mean, people wanted this, right? They wanted to decide on their own. And it's like, okay, well, decide. If you want to make your workspace safer, frankly, one of the most cost-effective things you can do is have an air filter so you can clean the air. So if somebody does come in sick, it's less likely that they'll pass the germs on to somebody else.
Excellent advice, as always. I so appreciate your time. Thank you, Dr. Labos.
You take care.